Bismillahirrahmanirrahim. Assalamu alaikum. I am Yaz Ahmed Khan. I am speech and language therapist. I am neurolinguistic practitioner. I am clinical psychologist, motivational speaker, and trainer. So today's topic is introduction to first session. When you conduct any new patient, when you attempt any new patient's session, how to introduce and how to take a first session. The today is this topic. First of all, you take a history, and the history is comprised on different type of forms. You can use your own form, and different institutions, different organization develop their own history form, and then they conduct it and apply to their uh, different clients. So the history form is consisted on different parts, either it is medical, either and different. It is according to the needs of a field. Like speech and language pathologists use this form. It is consisted on like it is consisted on demographics of clients, the name, gender, age, father names, and the address of their home city. So that is called demographic form, the first step of the parts of the this form. The other is the patient, the therapist asks the child's parents, caregivers about the speech and language problems of a child. Either he is with speech language issues or other, and on one single, two or sentence level, or he communicate with gestures and different others. So you should write down on your history form described by the caregiver and parents. The third form parts is prenatal and birth history. Um, you should ask from your parents of or caregiver of the child about the prenatal history. Either his mother was exposure from illness or other different accidents or any illness. So if they said he has any problem when the child was in his tummy, and so you should write down on your history form. So you should include birth history, the length of the pregnancy, either child is full length birth or he is premature. You should ask about the condition of the child, either he was weak or he was healthy, either he was cry at the time of birth or not. If he cry late, then you should write down on your history form and include at your case formulation. So you should um, and after this, medical history, either child is taking any medicine, any accident, major hospitalization, if he hospitalized, why he was hospitalized, and how is no, is he taking any medicine or any medicine uh, showed its side effects or not. So you should write down on your history form medical history, and any major disorders, fits or seizure disorder or high fever in any stage of his life, or so you should consider it. After that, you explore the developmental history from caregivers, parents, about his milestones like walking, neck holding, crawling. Is he uh, reach all these in time or not? So these are more important in case history form because they give you an idea for the care formulation. and you can when you are applying different checklist or different tests to assess them, they will helpful for your uh, case formulation. And you should ask them about their uh, first word when the child speak out his or her first word, and what was that age of the child, and when he was started walking, standing, neck holding, and either he can walk independently or not. And you should ask about the child's speech and language. Uh, is he on one word, two word, and the way of communication? Either he communicate with gestures or a single word, and is he or she can recognize common things, common objects like car, doggy. Either he recognize his mother or his or her father. So you should write down on your case history form. After that, you should uh, explore the history of education. Either child is a student or not. Is he going to in a special school, or either he is going to a mainstreaming school? So all these things you write down on your history form, and after that, when you are formulating your case, or you will write down your report, you should mention them on that. After when you have completed your case history form, so you should move to another part, is the oral motor examination in speech and language pathology. And oral motor examination is consisted on you should write down the child name, chronological age, date of birth, speech and language pathologist who is examining. So first of all, you should examine the child's mouth. Either he can open uh, its uh, means like kind he open full or partially its movement. Either he can do or not bite or click the teeth. So after that, label facial controls like you should can do alternate kiss and smile, like so child can do this or not. Either he partially this can show you the alternative movements of the child's lips. After that, lingual control, out tongue. You should examine the movements of a child's tongue. Either the child can move his or her tongue independently, its range, its movement. Either he can touch with his or her tongue on upper and lower lip or not. You should observe the sometime children has tongue tie. You should do it, and uh, alveolar ridges is his or her teeth can reach out. So you should examine them. And then movements of lips, you should and open and close the mouth, and kiss, blow, smile, and all these things. After that, you should move to didiocokinesis, rates multiple oromotor phonemes movements, alternative movements, as well as sensual movements like pa pa pa, ta ta ta, ka ka ka, and after that combinedly pataka pataka. You should examine this if child can do or not. This is the first session you are conducting with child. So you should include these things during your session. Thank you.